All right, I'm so excited for you to hear this. We're going to talk about GLP-1s and weight loss specifically. We're not just going to talk about like what they are and the symptoms. I feel like you can find that on the internet, but specifically we're going to talk about what me and Wendy, as professional clinicians in the industry, have seen and know about GLP-1s and how it impacts people who might not struggle with eating disorders, disordered eating, or body image, and also how they impact with is people who do struggle with their relationship with food and their body image. I also answer all of the questions that you left on Instagram, and I'm going to link a few articles in this video so that you can read more up on GLP-1s. All right, so enjoy and let me know what you think. So, hi, Wendy.
Hello,
How
Danielle.
are you?
I'm I'm happy to see you.
I
It's
know.
a nice feeling to be in your presence.
Yes, same here. So, do you want to introduce yourself? Tell us a little bit about you.
Sure, I would be so happy to do that. So, my name is Wendy Oliver-Pyatt. I am a board certified adult and addiction psychiatrist. I'm a fellow of the Academy for Eating Disorders and the American Psychiatric Association. Saying that really is more to just say what my background is. I am first and foremost a psychiatrist. I did my residency training at NYU Bellevue many, many years ago, really with a deep passion and compassion for severe mental health issues and community psychiatry. And I did a lot in the area of developing mental health programs, primary mental health programs, before I ever started eating disorder programs, which many people I know think of me as like an eating disorder person, so that's why I mentioned that. So I've developed five different higher levels of care program. Four of them are primary eating disorders. One is primary mental health and primary eating disorders. And then most recently, those two that I work with now are Galen Hope, which is my in-person brick and mortar program here in Florida. We have two locations. Galen Hope does treat primary mental health and primary eating disorders in a very unique way, which incorporates assertive community treatment and community integration. So it's not just the acute stages, but it's like the follow-up and the reintegration that's very important to me. That comes from my community psychiatry background. And we are also treat primary eating disorders. And then within health, which is a program that's available nationally, and it's a primary eating disorder treatment program with very intensive, enhanced, we call PHP and IOP programming. So we can work with people that are pretty compromised through within, which people don't realize that necessarily, but it's a very comprehensive program with nursing and remote patient monitoring. And we do send food into the home to assure exposure therapy and weight restoration for folks in all sizes of bodies that are needed when it's needed as part of treatment. So those are my two programs. My passion points are with both of them, and I think both of them are also really poised to help people with like the long-term, recovery process. So that's a little bit about what I do, and I'm the co-founder of Weight Stigma Awareness Week, which is coming up in the end of September, and I would love to have you join and participate in that. And I've authored a couple of books, most recently one on binge eating disorder, which I'm going to do like a republication on that really addresses these GLP-1s. So thank you for inviting me. I know that was kind of long, but I
No,
wanted to
that's
give a
perfect.
little background.
Good. No, we want all the details. So I'm so happy that you're here. I always send my clients to Galen or Within, and they have the most amazing things to say. Specifically, the details and the community part of it is really, really good.
Oh,
The
thank you so
reintegration.
much.
I love
You're an
that.
amazing person, and I've known you since you started
I
in the field,
know.
and you were always the brightest shining light for us at OPC. So talented, and I
Yeah.
love seeing your evolution. You're so, so good with these patients. They are
Thank you.
blessed to work with you,
So sweet.
and to learn from you and be guided by you. You're a wonderful
Thank
asset to this
you.
field and our community. Really, I mean that so much.
Thank you so much. Yeah, for those of you who don't know, we know each other since what, like a while ago, like years ago. I'm
What
like,
year
how
did
old
you
am I?
start? What year did you start? I don't know. We're
Yeah.
gonna date ourselves, right?
Yeah. I worked in OPC for like more than 12 years in different roles.
What year do you think you came? Do you have any idea?
Let me think. I think 2022,
You mean
2012,
2012?
2012, 2012.
Wow, incredible.
Yeah. Yeah.
Amazing.
I love
Amazing.
it. I love
Okay.
it. I
Well, we
got,
were blessed. We were blessed. And the
oh
field is
yeah.
blessed. So
Yeah, yeah, it was amazing. It really touched me in the best way possible. So
here you are helping people
here
live their
we
lives.
are, connected
Amazing.
again.
You have the best Instagram. I love it. If
Instagram
anybody wants to have
OG.
permission to eat, like turn on your Instagram and I'll be like,
Let's
you're
do
going to be
it.
on there having waffles. And I'm like, yes, go girl.
Yeah, always. It
Yeah.
helps. Okay, so let's talk about it. This is what I want to talk about, like I already
Yeah.
mentioned.
Yeah.
I want to talk about GLP-1s
Hmm.
for people in general, just because a lot of people come to me who
Yeah.
are like, I don't have an eating disorder, so what do I do? What are the
Yeah.
recommendations?
Yeah.
And then kind of apply it to people who struggle with disordered eating and eating disorders.
Right.
What I do want to get into is the stuff that you can't find on the internet. So it's our knowledge, our
Yeah.
clinical professional knowledge on if you were
Those.
to ask me, this is what I would tell you. So
Got
let's
it.
go a little bit into like what it is very quickly because you can find it wherever. And then we can kind of talk about the questions that I got asked from my followers.
I am happy to do my best to help
Yeah.
help with the
So let's
conversation.
start talking about it as GLP-1s for weight loss. I think there's been a big change. They started out as um, medication for diabetes.
Right.
And then quickly people were
Ozempic.
like, oh, Ozempic. Yeah. People were like, okay, I'm actually losing a lot of weight on this. And then it started to kind of blow up with celebrities and just
Yeah.
now it's like a whole movement. There's different ones.
Hmm.
Um, I want to talk about kind of how it functions
Hmm.
and the different side effects that it gives us. I think
Yeah.
physical side effects, but specifically also the mental side effects that it can have for
Right.
us, for the general public.
Yes. So, well, let's start off by just kind of putting GLP-1s in a little bit of historical context and just think about the fact that throughout so much of history, there's been this different evolutions of weight loss products. So, one of my most recent talks, it's like really thinking about GLPs, not as this like, oh, it's this magic bullet, everything's gonna be great. Just remember over time, our society has consistently, because of diet culture, been focused on pursuit of weight loss. And GLP-1s are like kind of, a part of that whole continuum. And with the onset, I remember this is a big industry since GLPs have come to the market, the weight loss industry has like boomed from 2022, about 5.1 billion spent on weight loss products, and now, and even just recently as 2023, I don't have 2024 numbers in front of me, but over 50 billion and it's on weight loss drugs. So the industry is really, really growing because of GLP-1. So there's a lot of money to be made for us being miserable trying to
Hmm.
lose weight. Diet culture makes a lot of people a lot of money.
Yep.
So, how do they work? Well, these are injectable medications and they mimic the hormone glucagon-like peptide, GLP, glucagon-like peptide. And there's some other newer versions that have more than like some added kind of mechanisms of action that we don't necessarily need to get into those, but they do regulate the blood sugar levels, slow down gastric emptying. And so what happens is when it slows down gastric emptying, you've got food in your tummy, and so you get full kind of early. So when you talk to people taking GLP-1s, a lot of times they're like, I don't feel hungry. I don't have any desire to eat, because in reality, we think of wanting to eat as just this emotional thing sometimes, but it's very physiological too. So when we feel full, that point of our brain that's triggering us towards like food seeking behavior just isn't really happening in the same way. And
Mhm.
that's insulating, it's stimulating insulin secretion, inhibiting glucagon secretion, and so it really drastically reduces your appetite. What's
Mhm.
also really interesting, and you mentioned how they started off, for diabetes, these medications started. And what I find very interesting, so that drug is, the brand name is Ozempic, and that was for type 2 diabetes, and that was used to control blood sugar, right? And so yes,
Mhm.
okay, here we go. That makes sense. But I think this is really important to point out. For diabetes, with Ozempic, the approved doses are zero point 0.5 milligrams, 1 milligram, and 2 milligrams. So when the FDA approved the same exact compound for I don't use the words, the O
Mhm.
words. I don't use
Mhm.
those. But when they got approved for treatment, the dose was 2.4 milligrams. So there's a very kind of aggressive way these medications, are being prescribed for weight loss. And I really think that's tied into weight stigma and blaming the patient and just, I mean, look, people cut their stomachs up to try to lose
Mhm.
weight. So it's no
Yeah.
surprise they would do this. However, it is just, I think, a really important point. And I think some doctors are starting to realize, like, maybe we should pay attention to that. Maybe we should pay attention to the pace of weight loss and what's really going on with these patients physiologically. And boy, do I have some stories for you.
Yeah, I think also the fact that doctors don't really, well, the doctors that I have been told about
Yeah,
don't really have that way of assessing, like their own way of
correct.
assessing the client's relationship with food, if they struggle with disordered eating, with body image, with
Right.
eating disorders in general. So the fact that this is such an like aggressive dose that they started out with and they're
Yeah.
doing the weight instead of actually assessing what's going on before just like recommending this quick fix that will just like magically heal
Yeah.
all their
And I
struggles.
think what's really not only just perplexing, but just maddening to me is these medications were approved by the FDA and they have black box warnings for certain medical things that is going on, like thyroid medullary carcinoma and things like that.
Hmm.
But, there's no comment about, hey, by the way, watch out for this person losing weight too quickly and being medically destabilized as a result. Or, hey, by the way, these medications like mimic a lot of like the behavior and the experience of somebody with eating disorders, like the number two most, morbidity and mortality of all psychiatric conditions. Like these medications are inducing what what is really eating disorder
Yeah.
symptoms.
Yeah.
And there's no like sort of, hey guys, be careful. These medications could be a problem. So I
Mhm.
just doesn't that just blow your mind though that
Yeah.
that there's no warning about eating disorders with these medications. That just still to this every time I say it, Danielle, I'm just like, is that really what happened? And it shows you too, though, that authoritative social institutions can really get it wrong. Like, let's
Yeah.
don't forget, like the U.S. government was. My dad tells a story because he was out of World War II in Germany and being in like the displaced persons camp, and the
Mhm.
U.S. government sending them cigarettes. He was sent these packages of cigarettes.
Yeah.
God, he didn't like them, but the government doesn't always get it right. Just because
Yeah.
something is FDA approved doesn't mean, oh, they did it right. They got it right.
Yeah. Doesn't mean they know everything. Doesn't mean that we have to trust them blindly and just like do what they
Hmm.
say. Because I also have, and this is more anecdotal, quite a few number of my clients, not that they were fine, they were probably experiencing some disordered eating or some body image struggles before trying Ozempic or Mounjaro or whatever that is, and came
Yeah.
to me because they developed an eating disorder that they cannot control. I think that's
Wow.
something that's very
They
important.
started off without the eating disorder and then they,
And
yeah,
that they can, because I think sometimes when, and the way that I like to explain it is, I get the cases where people didn't succeed with this, right? I'm sure you have a friend, an aunt, so many people, right?
yeah.
Have succeeded, done it, and been like, oh my God, it's supposed to know
I
my, right?
succeeded.
Yeah, I did
Yeah.
it. I get the possibilities. I get that. And I've gotten quite a few that you think you're gonna struggle with food, and you're like, oh, well, no, like when I'm done with it, it'll be fine. I'll deal with that later.
Yeah.
But no, like literally, these people cannot get rid of their eating disorder and they need way more support because of this. They thought it wasn't gonna
Yeah.
happen.
And
They're
you know
gonna
what's
be
so interesting
fine.
about that, Danielle, that, what people don't realize too is that when the FDA approves a medication, they've looked at a certain number of people, a very limited number of people over a limited period of time, right? And that's enough for FDA approval to happen.
Hmm.
However, and this goes with like, all sorts of things that FDA approves. And I'm not like anti-FDA, don't get me wrong. I'm not like against the FDA. I just think there's things that we can do better, that the FDA can
Hmm.
do better. And it's very important. I think the general public thinks of something as FDA approved it's safe, it's okay.
Right.
But we are all like right now, providers and patients alike, we're in the middle of a very significant scientific
Yeah.
experiment with these medications, and we're like discovering the effects of these medications as they're used more broadly and for longer periods of time than was ever done.
Hmm.
Emphasis on longer period of time, emphasis on more
Exactly.
broadly. So the population of people now using them is much wider, and the drug makers are really just relying on, or we as a society are relying on people reporting adverse events, right? And then it gets kind of factored into future labeling, things that the man, makes
Hmm.
people do. But we don't realize that these effects like you're describing are not things that like necessarily got pointed out in those earlier studies. So we're in
Exactly.
the middle of this experiment, and I get all kinds of journals that I read every morning and stuff in my inbox. There's so many to read, but every couple of days, literally, and I'm sure you get this too, there's
Hmm.
a new side effect. There's a new thing to worry about.
Hmm.
Right after I gave my talk for the National Alliance, like 3 weeks ago or 4 weeks ago, I literally got done with the talk and I went onto my email and there was an article that came in. I was like, "Ugh, I wish I would have included this, that these medication may reduce the effects of oral birth control pills." So it's like, how many of us
Yeah.
remember to tell our patients, I didn't know that.
Yeah.
Hey, you could get pregnant if you're taking this. Sarcopenia, the muscle weakness and damage,
Hmm.
weight cycling, of course. So
Yeah.
these are things that are not, of course, listed or even thought of in the recommendations in
Yeah.
the
Even
warnings.
when you Google it, like I like to think like my clients, right? That I'm like, okay, if I'm thinking about GLP-1s, what am I going to Google? What am I going to look for? The
Yeah.
side effects are nausea, vomiting, diarrhea, right?
Mhm.
Constipation. But then I'm
Mhm.
like, wait a second, what is like the rest of them? The new ones don't get like added in, right? And the mental side effects too. Some people
Right.
anecdotally have talked about maybe possibly suicidality being an issue
Right.
too. So
Hmm.
you want to give a little bit more light into what the physical and mental side effects are that you have
Yeah.
learned more about recently.
Absolutely. And I'm sure you can add to this because we're both kind of in the middle of this like experiment where we're learning too,
Mhm.
right? We're
Yeah,
encountering these
yeah,
people and we're learning about things. I think what I would like to start off in answering that question, if that's okay, is I want to talk about this whole thing about food noise
yeah.
that is getting so much attention. And I think it's getting turned into this like very positive thing, like, oh, wow, I don't have food noise anymore. And yay, isn't that great? Well, I think it's important to think about, first of all, what is food noise? Because the idea
Mhm.
of food noise is thought of as like this food noise is like not fun, of course. Like
Mhm.
nobody wants to have food noise. However, there's a very significant philosophical difference between the how do you manage food noise? So in the GLP-1 era, where people that I think don't know much about disordered eating, eating disorder, binge eating disorder, there's the idea that the way to get rid of food noise is to suppress your appetite. If you don't have an appetite, you're not going to have food noise. Yippee
Mhm.
hooray, right?
Yeah.
I believe, my conviction is that that is actually not solving food noise. It's remediating the symptom of food noise, but in a very pathological way, which is
Yeah.
via starvation. So I don't think the solution to food noise is to starve your body and not have cues of hunger. I mean, the cue of hunger is the life-sustaining force that we all need in order to live. So I don't think getting rid of hunger, appetite suppression is not a healthful solution to
Hmm.
food noise. Food noise is really a manifestation of being trapped between the desire to eat, the urge to eat, the need to eat, hunger, right?
Hmm.
And
Hmm.
fear about eating,
Yeah.
usually because distilling it down due to diet culture and weight stigma. So
Hmm.
food noise is a manifestation of a conflict around the need to eat and the ability to eat. And the way to solve it is not by starvation. The way to solve it is through healing, is through reducing shame, is through
Hmm.
addressing weight stigma, it's through treating primary mental health conditions that exacerbate disordered eating and eating disorder thoughts. It's through exposure therapy. It's through a paradigm shift into the principles of health at every size. It's through learning what intuitive eating is. It's through learning what mindful eating is, through practicing. It's through realigning ourselves, so that we are being careful about what social media influences
Yeah.
we take in. Like it goes on and on and on
The
as
layers.
what solving that is. So I'm very worried that the medical community also is getting really hyped up about these medications get rid of food noise. And it could be very, very, very dangerous to just get rid of people's, hunger. But
Mhm.
beyond that, the actual experience of being on these medications, I think just the idea that you're taking this injection to get rid of your appetite, right? That has a psychological messaging that you're kind of internalizing just through the taking of the medication, which by the way, it doesn't mean I think never ever, nobody ever should take the medications. I did not say that. But
Mhm.
recognizing that even just like the buy-in of the medical community of like, let's get rid of your appetite
Yeah.
as a great thing, right? That really keeps us potentially in the wrong, paradigm.
Mhm.
But, the effects of starvation are profound. I mean, all you have to look is the Keys study from back in, the conscientious objectors that were
Mhm.
exposed to starvation. And basically, rumination, depression, loss of energy, these are all things that we do see sometimes in folks taking these medications. I've seen probably the most, I've seen the depression and the
Mhm.
and the real extreme fatigue. I don't know what you've seen, but that's a big thing that I've seen.
Yeah, the fatigue. I find it also kind of like sad because it's like, oh, fatigue is a side effect. I'm like, but that's because of the starvation. Like that's because you're not eating. It's not like an actual symptom of a GLP-1. It's the fact that you're starving yourself. So obviously
Right.
you're going to be
Such a
fatigued
good point,
and
Danielle.
low
Yeah.
motivation and just like not really have the energy to, number one, feel well mentally, but
Yeah.
also have energy to go on your day to day.
And your emphasis, the word energy, people don't understand necessarily. Energy is energy, and we get
Hmm.
energy from food. We
Yeah.
don't get it out of thin blue air. Like
Yeah.
our body's energy comes from the consumption of food. So, energy is a good thing, meaning food is a good thing.
Right.
Food gives us energy,
We like it.
not to get rid of it.
Yeah, yeah. I think what I've seen is when people get on it, they, I think they feel like the side effects are going to be like, oh, no big deal. And they're
Hmm.
not.
Yeah.
And number two, the food noise goes away, but once it's time to get the next shot, it starts to get loud again. It starts to like wear off. So the food
Yeah.
noise gets loud again. And they're like, what do I do? And then
Yeah.
they get the shot and they're like, oh, fine.
Yay.
So the food noise gets numb. It doesn't get fixed.
Right, because you're not actually solving the issue.
Exactly. So when the vaccine wears off,
Yeah.
it comes back stronger
Mhm.
because you're not dealing with what's actually happening.
There's a great quote by Einstein, and I'll paraphrase and not get it exactly right, but he says like, in order to solve a problem, you have to go deeper than the level that it presents itself. Like, so we can't just like get, I call it symptom chasing, like, oh, we have food noise, oh, get rid of food noise,
Yeah.
make it go
Yeah.
away. And that's just so true. And like, I think you're also pointing to the other thing that I think people sort of forget because they're in such a rush to lose weight
Hmm.
is, are you going to take this for the rest of your life?
Hmm.
But one of the things I wanted to just say, because I thought, you mentioned this, and I think it's so important, like what can we help people with that we know just because of
Hmm.
us being in the field? And one thing that I want to say is that a big piece of this also, if a person does, is looking at GLP-1s, like is to have a clinician that does understand eating disorders,
Yeah.
not just the cardiologist, the endocrine, like having somebody who understands disordered eating and eating disorders, because a very crucial thing is number one, a risk benefit analysis. So
Hmm.
any
Hmm.
intervention by any doctor is supposed to first do no harm.
Yeah.
So that's like our oath is to first do no harm. And any intervention requires a real dedicated conversation to the risks and the benefits of these medications. I think there's going to be some lawsuits down the road. I've actually
Yeah.
heard of that because people are not getting proper education about the risks and the benefit of going on these medications. That's number one. And then number two is that if the doctor, let's say the decision is to go forward with the medication for whatever reason, I'm
Hmm.
not going to say what that might be, but there are some, reasons why people go on these medications. And I don't want to pathologize people for going on them, and we're not here to blame anybody or whatever.
Right.
And if the doctor prescribing the medication has the attitude of like, any weight loss is great, rah, 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 it's all about weight loss, lose weight, did you lose weight, blah, 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 which I think is most doctors, that reinforces all the wrong stuff. And it
Right.
reinforces the eating disorder, and it is a pathway to loss of health, not health.
Hmm.
Whereas if a doctor is really thoughtful and caring in the use of these medications, the doctor being very conscientious about knowing that the person is nourishing their body. Are you getting enough to eat? Should I lower the dose?
Hmm.
And is really intentional about being sure the person's nourishing their body adequately.
Hmm.
And that might mean also working with a therapist such as yourself or a dietitian or whatever, but recognizing that like sometimes people on GLP-1s, they need the dose lowered or they need to be on a meal plan where I've talked to people where they're like, damn, like I have to be on a meal plan when I'm taking these medications or I just
Yeah.
won't eat. Um, so that's really important. The attitude of the prescriber, the knowledge of the prescriber, like really does make a very big, difference. I
Hmm.
did say two things. I want to add one more thing. I think that for people in larger bodies, there's so much harm that can potentially be done because so many people in larger bodies already are very restrictive and shame-based in how they eat. And I think anything that causes them to eat less, they feel like they're doing the right thing and they don't even realize like
Right.
these things can cause you harm. We just had a 77-year-old woman at Galen Hope
Hmm.
who was given these medications by an endocrinologist that didn't know anything. And we had to send her to the hospital twice due to fatigue, and she had some electrolyte issues going on,
Hmm.
which were all tied to her. Even we had to put her on such a structured meal plan, and she still struggled to eat. And she had so much internalized weight stigma. She wasn't even like she thought a larger body, okay, whatever that means. But
Hmm.
she had so much internalized weight stigma, she could not fathom that she wasn't eating enough.
Yeah. Yeah.
Like,
Yeah.
not. And it's really interesting. These medications do cause a little bit of the distortion around that. Like some people are aware, wow, I'm not eating very much.
Yeah.
She
Hmm.
literally was like, no, I couldn't possibly. Because in her mind, anything that involves eating less is the right thing to do.
Right.
You know
Right.
what I mean? It's
Yeah.
just,
Like
the-
focusing on weight loss.
yeah,
I think people think that weight loss is
good.
the solution. Like, if I lose weight, then this will be fixed. When in
It's good.
reality,
Yeah. Yeah.
exactly. Like, weight loss is never the goal in any eating disorder recovery or not eating disorder recovery,
Yeah.
but especially in binge eating disorder recovery, because I think that's when people relate that the most. Like, if I lose weight,
Absolutely.
then I'm
And
recovered
that's
and I
that's the
decide.
population I'm very worried about with these medications.
Exactly, exactly, because they feel like they have to or they deserve it or they need to, when in reality, it's like, wait a second, that's actually causing you more harm. We have to
Yeah.
focus on so much more than just your weight.
Absolutely. And I think one of the things that's really important is really weight is not a behavior. Weight is not a relationship with
Hmm.
food. Weight
Hmm.
is just a number. And we've worked with thousands of patients, as you know, because you've been a part of
Yeah.
it.
Yeah.
And the healing that happens is really not around losing weight. The deep, deep, meaningful healing involves abandoning the pursuit of thinness.
Exactly. Exactly.
That's the
Everything
core
about
of it.
that. Yeah. Yeah.
Yeah.
Which is why I want to talk about this. It's like the battle between
Yeah.
that and Ozempic kind of reinforcing that, and then us being like, wait, that's
Yeah.
not going to be good. That's going to do the opposite.
It was scary already when we had gastric bypass happening, and it is the after effects of
Mm,
that, people gaining the weight back, the nutritional deficiencies related to that, the lack of enjoyment of eating. Let's also not
yeah.
forget that
Yeah. Yeah.
with these GLP-1s and Mounjaro and like gastric bypass, all these things. people forget these medications also make it where you don't enjoy eating because you get
Hmm.
full so fast and it makes you lose your desire to eat.
Yeah.
Or with, iatrogenic like purging and things of that nature. And
Yeah.
I remember when I was pregnant, Daniela, it was so interesting because I felt like, oh my gosh, this is what it's like when people have gastric bypass or something because
Mhm.
my my baby must have been like on my stomach or something because I would just get full really fast and I would see a plate of food and be like, oh my God, that's so much food. And I remember hating that because I was like, we were at an Indian restaurant. I'm like, I want to eat my saag paneer, my vegetable sanosa, my garlic naan. I had no interest. I was like, ugh, because I felt full. And so we
Yeah.
forget that just that full feeling is tied to a psychological piece, the
Yeah.
brain gut connection. So when you just feel full, like your brain doesn't turn on food seeking behavior because your brain is going, body, you don't need anything. And that is also tied with enjoyment of food. And screw that. We need to enjoy food. I don't care what your body, like,
Yeah.
don't make people not enjoy food.
I know, I
That's
know.
okay.
What are you
Okay.
gonna do? Like when you go
I
eat,
have a
when you're with
problem with
family
that.
members? Yeah. Well, yeah, social eating is so important too.
Yeah. Yes, the social aspect of eating for sure. But even just me
Yeah.
sitting down and having again, my vegetable samosa, like, don't take
Yes,
that from me.
exactly, exactly. So I want to get into the questions, just because
Okay.
we kind of have touched a little bit on a few. So my question is, if somebody without an eating disorder came up to you and was like, I want to go on a GLP-1, what do you say? Like, what do you recommend? What would your point of view be?
Mm-hmm. Hmm. Well, first of all, I would say, okay, why do you want to go on a GLP-1? Tell me more, right? What's
Yeah.
what's your reason for that?
Hmm.
Um, And then the next question is, what's your reason for it? What do you hope to get out of that, right? What are you
Yeah.
hoping for and why? So
Hmm.
those are some, I think there's a lot of questions, that follow that.
Hmm.
Uh, so those would be my first, I would have to know the answers to those questions. I'm
Hmm.
going to give an example of a case where I actually was kind of like, okay,
Yeah.
and this was a person that actually had been through eating disorder treatment and
Hmm.
really got into the paradigm of healing. And interestingly enough, the fact that she had really good eating disorder treatment and she really rejected diet culture was one of the reasons why in her case, and this shows you how nuanced it is, in
Hmm.
her case, it's safer for her than somebody who hadn't because she had so much understanding and treatment of eating disorders
Yeah.
and diet
Yeah.
culture and weight stigma. So she actually didn't want to go on that necessarily for weight loss as much as she was having very significant mobility issues,
Hmm.
which
Hmm.
were really interfering with her life.
Yeah.
She also had type 2 diabetes. So
Yeah.
she had
Yeah.
a really good medical reason, and it doesn't, and I remember when she and I spoke about it, she was like, if I hadn't been in your program before, and this was like years after she was out, by the way.
Yeah.
So she was like, if I hadn't been in your program before, I would have been totally going after this for the wrong reason. But she was in it but she was still concerned about nourishing her body. She was
Right.
still sure. And she had good providers that
Mhm.
were reinforcing that. And she contacted me and wanted to talk about it. And so we really talked it through the, and so she was like, if I had not been in treatment, because she actually did lose weight on it at
Hmm.
first, by the way,
Yeah.
that actually later on went away. Just wanting to know that. So,
Hmm.
but she said if I had not been on treatment, I would have just been so gleeful. I lost weight. Oh my God, this is so great. She said I wouldn't have even understand like the risks. And even when she gained the weight back later, she was like, she would have been so devastated. But it did actually help her with diabetes and it did actually help her with mobility.
Hmm.
It did help. And she started playing pickleball and stuff like that. So there was a lot, and that became kind of social for it. So there was like a holistic, long-term
Yeah.
positive for
Yeah.
her. However, she did start to gain significant amount of weight back. And I can't remember what happened now if she ended up going off of it. I can't even remember where she's at.
Hmm.
But the fact that she had a lot of this fund of knowledge. So having a fund of knowledge about the risks and the
Yeah.
benefits
Yeah.
is a big piece of it, and being prescribed by somebody who understands that.
Mm-hmm.
Um, I've had people tell me, that go on to it for diabetes and they're living a larger body and the diet and the hemoglobin A1C normalizes and the doctor wants to raise the dose. And I'm like, no, you don't need to raise the dose anymore. Because the person's already struggling with their appetite. They're like, I don't have much.
Mm-hmm.
Like, you don't need the dose raised. Your hemoglobin A1C was fine. That's going to contribute to sarcopenia, which is muscle loss. That's going to end up with weight cycling. Stop.
Yeah.
So this is so good. And I think I'm sort of answering it by giving anecdotals because there's so much
It
nuance to every case.
depends
Yeah, it
for
just
sure.
unfortunately does depend.
Yeah. And that's what I love about this. It's that we actually live in the nuance. If you're able to see that in a neutral and informed way,
Right,
then it's beneficial. Then we can be like, all right, let's
right,
talk about it. But when it's
right.
very black and white or against it or pro it, that's when it can get tricky.
Yeah. Yeah, I
Yeah.
think it all comes down. At the end of the day, good medical care
Yeah.
involves a foundation of understanding any ailment
Hmm.
from a biopsychosocial or biopsychosocial spiritual foundation.
Hmm.
So whether you have diabetes or whether you have lung cancer or
Yeah.
whether whatever, really understanding a biopsychosocial piece, the foundation of like, how did this condition come to be and how are we
Hmm.
going to address it? Whereas with these GLP-1s, like there's like so often in our society, we want to skip the line. We want to have the easy answer. And people are just thinking, oh, it's a biological cure. It'll just get rid of your appetite.
Hmm.
When you're missing that whole comprehensive assessment. If you don't have a comprehensive assessment, you're not going to have a comprehensive treatment, which means you're not going to have a lasting outcome.
Yeah.
So
Yeah.
that's one of the big problems is our quick fix culture, right?
Yeah. And I think somebody wrote in that this was such a good question because she struggled with an eating disorder or was struggling with an eating disorder. And she is taking, I think it was Ozempic
Hmm.
for diabetes.
Right.
And she said, I'm actually experiencing body changes and people are commenting on them.
Oh,
So she's like, I'm
yeah.
dealing with my eating disorder. I'm taking it for diabetes, but then it's
Right.
kind of triggering me more because now people are like, oh my God, look at you. And it's like,
Yeah, for sure.
how do
That's
I
a
even
mess
handle
right
this?
there, right? Yeah.
Mm-hmm.
I went to the dentist yesterday and for whatever reason, I don't know why, the person was like, "Oh, you've lost weight." And I'm like, "Did I?" I was like, "I didn't know
I know.
that." Okay, great.
Yeah.
I'm happy to notice how my body looks and thought it was okay to comment on it.
Mm-hmm.
But,
Mm-hmm.
I'm not triggered by that. I laugh at that because
Mm-hmm.
I've been through this for many decades now at this point. But I think about our patients that go there and kind of experience that. And I remember so many stories of patients like that. And I think it's nice as a clinician to come up with like those touche one-liners that you can
Yeah.
always keep in your back pocket.
Yeah.
And not to be mean, but it's okay to be a little snarky, I think, to
Mm-hmm.
protect
Yeah.
yourself and help you a little bit.
Yeah.
Again, people are coming usually from a good place, but it's just so unhealthy and so unhelpful. But having like one-liner zingers in your pocket is good. I didn't even say anything to her. I didn't say thank you though. I literally just was like, because I think I'm so, we're so far down this road, right?
Yeah.
We
We're
wouldn't
so
even,
aware.
yeah.
Yeah.
I was just
Yeah.
literally like, I just kind of
Wait,
was like,
what?
huh? But I think our patients need like those little zingers. And
Yeah.
I like to give people the image of a lion, like a
Mm-hmm.
big lion letting out a roar. I'm like,
Mm-hmm.
and let out your form, whether it's a "Grr," little or whatever you want it to
Yeah.
be, let out that roar to protect yourself. So coming up with these like kind of like, well, what would you like to say? Because it's gonna happen. What do you want to say in
Yeah.
scenario A, B, or C, right?
Yeah. Yeah. I always like to say like mirror, be a mirror to them because sometimes people don't notice, right? And they're like, ah, like they think that's their way of like connecting and welcoming someone. And like, so what I like to say is mirror to them what they're doing. For example, oh, I didn't even notice you comment like looking at my body, or I didn't even notice you noticing my
Right,
weight
that's a really good
before.
point.
You
I
know what I
love that.
mean? So they could
I
be
love that.
like,
Oh, I didn't know you were
oh,
looking at my body. I
I
didn't
didn't
know
know
my
you
body
noticed
mattered
my
that
weight
much to you.
before. Exactly. So
Right,
they could be like,
right.
oh, they're getting the message
That's a,
of
I love
I've been
that,
checking them
Danielle.
out. You know what I mean? So if you're just
I
like a
love
little bit of a
that.
mirror, they can also reflect like, oh, they feel watched or they feel observed
Hmm.
from how
Yeah,
they were before.
yeah, I love that. That's education in a very sincere way. It's not mean-spirited,
Hmm.
but I think it also would have the effect of, getting people to at least have a little pause, like, wow,
Right.
maybe.
It's like, this is what I'm
Yeah,
doing. Uh-huh.
yeah,
Yeah. And you never
absolutely.
know. And I
Absolutely.
think also something, this comes up often when
Hmm.
people, for whatever reason, do start to lose weight or they have lost weight because of they were like on a diet and then they just gained it back. Um, they do experience that. They do experience the fat phobia and the weight stigma. And they're like, wait, people were congratulating me when I was at my most miserable. What do I do? Like, obviously, I don't want to be in this body. So it's just processing what comes up for you in those moments because it is something that unfortunately we have to live with.
Yeah.
But yeah, yeah,
And I think it's nice that we have each other and we
yeah.
can, I love that you're out in the field helping people. I think
Mhm.
groups are a really nice experience too. So you can
Yeah.
help a group helps reinforce like what's happening in individual work too, because it's like we're all in this society that we're like, oh, and
Yeah.
so being with others that are like-minded to help reinforce it and like, hey, I'm not the only person in the room that has a problem with X, Y, or Z. And I think
Yeah.
that's really
Yeah.
nice as well.
Yeah. That struggles with that. Yeah. So that was an interesting
Yeah.
one. So another question was, what are GLP-1s not addressing when it comes to overeating or food issues? Everything.
What are they not addressing? Well, I think we kind of hit on that, right? Is like they're
Yeah.
not addressing the fact that um, people have food issues, quote unquote, oftentimes have shame issues,
Mm-hmm. Mm-hmm.
right?
Mm-hmm. Yeah.
Have
Yeah.
shame around meeting their needs, about around having needs, around enjoyment of food,
Mm-hmm.
taking in pleasure from eating,
Yeah.
shame around internalized stigma. And so these medications don't even touch on, again, going back to the biopsychosocial foundation, right? These medications don't really touch on these psychological aspects of what impacts your relationship with food.
Mm-hmm.
So I think
Mm-hmm.
that's the first one. We could go
Yeah.
on that time, but that's probably the first one. With our limited time, I'll just stick with shame.
Yeah.
They don't address
The
shame.
shame of it all that keeps you stuck.
Yes, for
Also,
sure.
this is a really good one that I often get. Can someone take them and still do the deeper work of food freedom and body image healing at the same time?
Potentially, potentially,
Mm-hmm.
potentially. I'm not a black and white thinker very often, other than like being very black and white about weight stigma and diet culture.
Yeah.
I'm like very
Yeah.
black and white about that.
Yeah.
But every human being has their own
Mm-hmm.
journey of
Mm-hmm.
healing.
Yeah.
And who am I to say, Daniela, this is your journey, or nor would you say, Wendy, this is your journey. It's more of an exploration when
Yeah.
we work with people to help them find their journey that is working,
Mm-hmm.
for them. I think it's harder because how do you do that when you're really, how do you have food freedom when you're like taking something that knocks out your appetite or your hunger?
Exactly. Yeah.
Kind of
Yeah.
hard,
Yeah.
but maybe it's a stage, maybe it's a step, maybe you're doing this for a while and then maybe later you maybe you want to try not taking the medication, right? It's like
Yeah.
we try to start with people where they're at and go from there. Like, and then when these meds first came out, I remember the first phone call I got for a patient at Within that had been was I was like, are we going to take a person on these medications? And I was like, what do I do? And I was like, yes, we're going to take a person on
Yeah.
these medications.
Yeah.
And then we start with people with where they're at. And we obviously, if somebody's doing something very dangerous that isn't safe, they're taking the medications and they're drastically losing weight. And like,
Mm-hmm.
no, in that case, it's like, no,
Yeah.
we're not doing that. No.
Mhm. Yeah. Yeah. I think also it what you're nervous about will come up regardless, at least with my experience with my clients. So some clients come up and they're like, "Oh,
Yeah.
I want to go on them." And I'm like, the same thing I say, like, I'm not one to decide what's best for you. We talk about it, all the things, information, knowledge. And when they do decide to take it, like the nerves and fear is still there. Like the nerves about body image, about eating, about
Mhm.
being judged, about social anxiety are still there. And it comes back again when the vaccine
Yeah.
starts to wear off. And then the nerves come back way more when they're like, wait, I don't want to do this anymore. So what do I do? And they're like, like,
Hmm.
what am I supposed to do? And it's like, okay,
Yeah.
well, now we have
Yeah.
to go back to what we were doing before and do the work. We got to continue doing the work.
Yeah.
It's not like a quick fix that is just
Yeah.
gonna
Yes.
freaking go. So, lastly, what would you say to someone who's considering a GLP-1 but also knows they're still working through food and body image issues?
Hmm. That's a good one. I would say to that person to pick up the phone and call Daniela. Have some
Get
really good
support.
sessions
Yeah.
to some really good sessions with somebody really knowledgeable in this space, to have a primary care provider who's on your team that's really knowledgeable in this space before you make that decision.
Yeah. Have someone to talk it through with.
A dietitian, a
Yeah.
therapist, a medical
Specialist.
doctor, all of the above, at least
Mm,
one of the above at the bare minimum. And
awesome.
remember that authoritative social institutions sometimes get it wrong. So we have to protect ourselves and our mental well-being first and
Hmm.
foremost.
Hmm.
And the World Health Organization of Health does not only talk about the absence of disease or infirmity, but it's a state of physical, social, and psychological well-being.
Yeah.
And
Yeah.
we all have to think about our whole person health.
Yeah. They're all
And enjoying
connected.
your relationship with food is, I think, a part of health.
Hmm.
So I think that we cannot exclude that from our definition of health. And I encourage everybody to recognize that they deserve nourishment and self-care and self-compassion.
Yeah. Amazing. Well, thank you so much, Wendy.
Well, it
It
was
was so,
delightful
so
spending
good to
time
see
with you. I'm glad
you.
I got to see you. I hope to see you in person
Yes.
as well, so
Yes.
I can give you a hug.
All right, that was it. I hope you got what you needed from this. If you have any other questions or comments, leave them down below and we can continue the conversation. All right, bye.